Hello, my friends. I'm Dr. Bree, and today I want to talk to you about some of the most common exercises that I see that are core exercises that can really be a big problem for not only your low back, but also your abs and your pelvic floor, especially your pelvic floor. If you know me, you know I'm all about keeping your pelvic floor safe. So let's go ahead and get to these moves right now. I'm going to show you what not to do, and then I'm going to show you what to do instead. So join me on the floor, come down through your side onto your back, and don't do what I'm showing you not to do. I will demonstrate, but you don't do it. I do want you to try with me and practice with me when I show you what to do instead. So the first one that I see a lot of is a double leg drop. Now, there are, to be honest with you, I really don't think there's that many people who are strong enough to do this move successfully. So what I'm talking about is this move right here where you drop your legs down, sometimes all the way to the floor, and then come on up. Now, that is really hard for me. I'm going to show what I see so often. And do not try this at home. This is what I see. And I'm putting my arms up just so you can see my back. So look at what's happening here, and then look at my belly, and like this. Okay, there's so much wrong happening right there. And I actually don't even feel that good right now through my pelvic floor, just demonstrating that. So what happens is when your legs go down, and if you're unable to use your abdominal and core muscles correctly to stabilize against those legs that are coming down, your back is going to crank up off the ground. That, especially if you're not engaged correctly through your core, it's going to overstretch your front abdominal wall and cause an increased risk for diastasis recti, for belly pooching. It's also going to strain your low back. The other thing it does is it puts pressure on your pelvic floor, not only in this position, but also when you're straining to bring your legs back up. So you're going to be like bulging down pressure-wise as you bring your legs back up, which is going to cause a lot of downward pressure on your pelvic organs and is really bad if you have prolapse, or it can actually make prolapse happen if you don't have prolapse. So again, what we don't want to see is this sort of arching and then this bulging of the belly and then coming up. Not good. What I want you to do instead is, first of all, engage your core, thinking pelvic floor first and then low abs. So pelvic floor, nice and lifted. It's like you are gently stopping the flow of urine or gently stopping passing gas. That gentle squeeze and lift of the pelvic floor muscles. It's a lift, not a bearing down. Then feel like you're drawing the front hip points together. So it's like a lift here and a drawing in here, kind of like a capital letter T, lifting and then drawing in. That is what we want to feel. Tight, tight, tight down here. Not just sucking in the belly up here, up high. It's actually this lift feeling down low, like you're lifting your navel upward, not just sucking it in. Okay? So that's the first key. I want you to start by just literally lifting one leg and setting it down and lifting the other leg and setting it down. Even that, when you're doing it right, is a lot of work. So when you're doing it right, you feel that nice active lower core and entire core really. You feel that the only thing moving is your legs. You're really still and stable through where my fingers are right now. Nothing is moving up here. It's just the legs. Your low back is staying nice and close to the floor. It's not arching. So this might be where you stay. Now, if you don't have prolapse, then try lifting one leg up and then the other. If you do have prolapse, it's a good idea to be very careful or avoid exercises where both legs are off the floor, okay? Just know that if you do have prolapse, you typically want to avoid those unless you've worked up to it. So if you do have prolapse, just keep doing this little marching exercise. It could be really, really good for you. Or you can straighten one leg and set it down and straighten the other leg and set it down. If you want to try going up a little bit more, just touching one leg to the ground and then the other is usually a lot. And then, of course, if you want to try that leg lowering exercise, you can, but just be honest. For me, I'm pretty strong through the core. but I really can't go down much lower than about here without starting to feel my back wanting to arch. So I only go down right to that point where I feel my back wants to arch, and I don't push it farther than that. So I keep it really careful, and I think about pulling my side waist down toward the floor. So side waist pulls down toward the floor. That lower core is nice and active. I'm not letting my low back arch, and I'm breathing. So I like to exhale as I come back up with my legs. So this is enough for me. This is enough. And again, modifications would be touching one leg at a time or straightening one leg at a time, okay? So be very careful with the double leg drop. For most people, it's just too much. One more thing I will tell you is if you try it, you can put your hands in kind of a triangle shape underneath your bottom, and that can help. It's providing a little assist if you're gonna try this, but I still want you to really think about drawing the side waist down toward the floor and zipping up that core. So you're not just sucking in up high, but you're zipping up pelvic floor first and then low abs. Okay, on to the next move, which is crunch. So you probably know that the abdominal crunch can be problematic. If you have prolapse, it can put a lot of downward pressure. And if you have diastasis recti and the separation between the six-pack muscles, that split causes a pooch, a doming and a gapping. So it can be real problematic to do a crunch. If you do it where your belly is pooching up every time you crunch, that's a real problem. So what we want instead is, first of all, you might need to avoid crunches. If you have prolapse and or diastasis recti, you might need to avoid crunches for now. But if you feel like you have worked up the strength in your deep core and you want to try crunches the right way, then this is what I suggest. I suggest making sure that you have something either between your knees, like a yoga block, or something that you can kind of squeeze your knees against. I'm gonna grab a yoga block right now just to show you. Okay, through video magic, I have a yoga block now. So place this between your knees, and this helps activate your center line. It activates your inner thighs and turns on your pelvic floor to help protect and lift you and support you from the bottom up. Now, I also like to press my heels into the ground and toes up toward the ceiling. This just fires everything up, so I'm really, really active through my core, through my entire body. I'm turned on and I'm ready for this. The other thing is you want to exhale with the crunch. So you're turned on, fired up and lifted, and then you're exhaling, breathing out as you crunch. When you exhale, it naturally pulls in your deep abdominals, your transversus abdominis. So exhale as you crunch, and maybe try it with your hands out in front of you to assist rather than behind your head. The farther your arms are back, the harder the crunch is. So just start out with your hands in front of you. So pulling in and exhaling as you crunch. That is a safer crunch than one where you're just kind of not breathing right and you're not thinking about it and your belly is pooching up. So if you crunch like this, that can be a lot better. And of course you can put your hands behind your head. Just make sure that you're not just bringing your neck like this. You actually need to be lifting off the floor. Let's do last one and release. Now, if you do that crunch and if you feel, even taking all these precautions, if you feel like there's downward pressure on your pelvic floor, or if you feel like there's doming or gapping in your belly, then it's not right for you, okay? So our next move is plank. Okay, plank can be a tricky one. If you have prolapse, it can be tricky to transition in and out of plank because of the downward pressure that you can feel in your pelvic floor. And if you have weakness in the front abdominal wall, like diastasis recti, it can be a lot, it can be too much in the early stages of your recovery to do a move like plank. It's a really challenging move. So let me show you what would look wrong. This would be wrong for plank. First of all, if you have prolapse and you just come into a plank, this coming straight into it can be a lot of downward pressure and can cause symptoms. Another thing that's wrong, if you're doing plank wrong, would be sagging through here, sagging through your low back at all, where there's ever sagging through your low back. Or if you're way up here, then you're just not really getting the benefits of the exercise. So ultimately, we want our plank to be really long through our heels to the top of our head. And we want to be lifted through the pelvic floor, pulled in through the low abs. So zipped up through the core. Now, plank just might not be right for you quite yet. You might need to work up your strength. But if you're ready to try it, and to try it in a safe way for your pelvic floor, what I really recommend is transitioning into it. So start on your hands and knees, where your arms or your wrists are right under your shoulders and your knees are right under your hips. And you're just gonna walk your hands out about an inch or two in front of you, and then shift your body forward so that your shoulders are over your wrists. Now from here, you are going to straighten one leg at a time. So you're gonna straighten one leg. Now strongly push into that foot, lift your pelvic floor, pull in your low abs so you're zipped up through the core, and then exhale as you come into the position. And then set that same knee that you bent down, and then the other leg comes down. Now what that does is it kind of eases you into the position, and it allows you to take it step by step so that you're not just going straight into it, which can be a lot of pressure for your pelvic organs, and a lot of kind of all of a sudden you have to be engaged everywhere. This allows you to take it a little bit more step by step, kind of break it down a little bit more. So let's try it on the other side. So we start with hands and knees position, bring our hands a little bit in front, then bring our body so our shoulders are over our wrists. And now let's go ahead and lift, let's see, the other side first. I think I'm doing the other side. So lift your left leg off the floor, lift through your pelvic floor, pull in the low abs, and exhale as you straighten the right leg to join. So again, it's just kind of taking it step by step. Then to come out of it, you bring the leg down and down. Now, of course, another way to modify plank is to not do a full plank at all, and just to begin with a knee plank or a knee and elbow plank. Those are also great ways to modify. Just be sure that no matter what, when you're doing the plank, you're zipped up through your core, you're lifted through your pelvic floor and your low abs, so you feel really strong and secure through your lower core, your entire core. You're not just sucking in up high, but you're lifted from pelvic floor first, okay? The other thing is to keep breathing. So even though you're nice and tight and strong and lifted through your core, you still need to breathe. So don't hold your breath, and just be really careful about those transitions in and out of plank. Okay, the last move I'm gonna show you is malasana. This is a deep squat, and I'm just gonna briefly touch on this because a lot of people don't do this move anyway. But it is there's an important thing about it. If you're to do a squat of any type, particularly a deep squat like this, but even air squats, you wanna be sure that your butt stays untucked. So what I mean by that is that you're not rounded through your back. Your bum is untucked. Now that goes for standing air squats as well. Make sure your bum is untucked. It's not tucked under. And that's the only thing I'll say about this, because not everyone does that move, but it is a great stretch and strengthener, but it can be very, very hard on your pelvic floor if your butt is tucked under. So those are my main moves for you today to really be careful about with the core for your back, to keep your back safe and to keep your pelvic floor safe. You want to keep those tips in mind. And if you are interested in more information about prolapse, please head over to my website. I have a brand new beginner's guide to prolapse that I think is going to be really helpful for you. And just check the video notes for the link to that and other ways we can keep in touch. If this video has been helpful for you, please give it a thumbs up, subscribe to my channel, and until next time, remember, as always, for vibrant health, eat clean, move every day, and you will shine brighter.